The position a baby is in when a mum starts her labour really can influence how the labour goes. For most women, the best position for their baby is to have it lying head down with its spine towards the front of her bump and lying on the left. It is possible to birth a baby who is coming in from the right-hand side, but because mum's liver is on the right, for some babies this makes the journey a little harder. So for the majority of women, starting with their baby on the left means an easier labour. If their baby is in what's known as a back-to-back position, like this, then the woman's labour is likely to be longer and more uncomfortable. The reason it's more uncomfortable is because the baby's spine and mum's spine are rubbing up against each other, which can create a really painful backache for mum, which lasts throughout the labour. So even between contractions, she doesn't get a break from the backache, so she doesn't really have a chance to rest, which can make her very tired. The reason why it tends to be a longer labour is because the contractions, instead of trying to open the cervix, are actually trying to turn the baby into a better position. So they're manipulating it. And this can be a very slow process, so mum may have many hours or possibly even a day or two of contractions where she's not actually dilating, and if she went to hospital she would be told she's not in labour because the contractions are turning her baby instead. The reason why the position of the baby makes a difference is to do with the shape of the pelvis. So the widest part of the pelvis goes from side to side and the narrowest part is front to back, whilst the widest part of the baby's head is front to back and the narrowest is side to side. So in order for the baby to fit well through the pelvis, the widest part needs to line up, and that way the baby can get in easily. And as I said before, if the baby is lying towards the left, it tends to find it easier because it doesn't have to work its way round mum's liver. So that gives you a little insight as to why it's important to have your baby well positioned when your labour begins. On the next video, we're going to think about how you might be able to achieve that.